Hi, this is Steve Latham with the Yale Interdisciplinary Center for Bioethics, and I'm here with Karl Surkan. So, Karl, tell us about yourself. Tell us a little bit about your educational background.
Well, I graduated from University of Minnesota with a PhD in 2003, which was actually in English, and I have a minor in feminist studies. And so I've always been kind of an interdisciplinary scholar. And I guess, in some ways I didn't take that traditional trajectory. I went from women's studies undergraduate degree to a PhD degree in English, and then I went back to women's studies in my teaching, and so that's what I'm doing now.
And where do you teach?
I've been teaching since 2005 at MIT in the program in Women and Gender Studies. And then I'm kind of adjuncting, so I teach in various other locations as well, and I'm kind of between Boston and Philadelphia. So
That's a large span.
Yeah, that's a 300-mile.
Are you on the train a lot, or do you
I'm
drive?
on the bus and the train and the plane. Yeah.
So, how did you get tied up with us at the Bioethics Center?
Well, interestingly enough, I think it kind of coincided with some of my interest in health social media sites and also precision medicine because I have been self-identified as a transgender person and I'm a person with a BRCA mutation. So I'd encountered a lot of different kind of health challenges and had sought out some social media groups to kind of discuss those with, and that kind of happened right at the time that President Obama was making a State of the Union address about precision medicine. So my interest was really piqued, and I just began to kind of surf around and look for information. And then interestingly, I found that the NIH was really open to citizen participant, so I started tweeting and virtually participating in webinars and other kinds of meetings, and then eventually I got enough interested in it that I went down to Bethesda and they let me join into the meetings, which I thought was great. And but it really was.
These are meetings on precision medicine issues?
Yeah, Precision Medicine Initiative, which is now transformed into the All of Us Research Program. Mm-hmm. So it's a longitudinal study of 1 million participants, which really is designed to serve the underrepresented biomedical research population in much more robust a way than previous kind of medical research has been done. But so I got interested in it because I was coming at it from kind of a methodological perspective out of women and gender studies, thinking kind of deeply about how to transform demographics and ways that it doesn't always serve us to just slot people into binary sex categories for research purposes, or put them into kind of a limited number of ethnicity categories. And I really wanted the NIH to kind of think differently about how they're collecting data if they were going to do a longitudinal study that really aimed to get at some of the diversity issues. And so it was about that time that I actually was I became in contact with Ellen Matloff, who's been at Yale as a genetic counselor in various different capacities. I encountered her through social media in several sort of breast cancer awareness and support groups, and one in particular that was interested specifically in disseminating medical information to patients. And so they had brought in a lot of experts, and Ellen was one of them. And so I had gotten to know her virtually without ever having met her at all, which seems to be the pattern in a lot of my my activity, I guess. And then at one point she suggested this program to me, and so Laura said, you really should talk to Karl. And so
this is Karl Pollard, who used to direct the Summer
yeah.
Institute before Laurie came.
Yeah, so I got on the phone with Karl Pollard, and I hadn't thought about the term bioethics, but the more I talked to her, the more I realized that everything she was saying kind of coincided with a lot of things that I'd been thinking about and teaching, and issues of access and ethics and minority populations and healthcare, and so finally she said, well, why don't you come do a morning lecture? And I said, okay, what's a morning lecture? And then I came actually and just was sucked in and became a student, and then I've been coming back ever since. So.
Yeah. So you've just finished a class today, right?
Two. Yeah.
What were they?
Yeah. So I am teaching the same course that I taught last year, which was ethics of LGBTQ care, which is aimed at kind of thinking through issues. I mean, specifically in healthcare, I think, or largely in healthcare, but even more broadly about kind of policies that affect people who are considered sexual or gender minorities, and that's kind of in line with the morning lecture I do on trans health. So we're thinking about Red Cross policies on blood donation for gay men, or access to reproductive health, or what to do ethically with transgender youth who are minors, or the history of intersex case management and surgical interventions on children, and how that's been kind of reformed. So, and then the second course that I'm teaching, which is new this year, and I'm really excited about it, so I'm excited to see what the feedback is. I'm teaching ethics of information, which is a lot about big data, data privacy, data sharing. I've been involved now for a while with a bunch of BRCA community activists
gene
around
studies and tissue banks, and
but specifically around data,
genetic
data and the sharing of genetic data. We were really interested in the Supreme Court decision that struck down Myriad's patent case on the BRCA genes, for example. So some of those issues. We've been watching Facebook and the whole Cambridge Analytica debacle. We've been looking at genetic data and how it's getting leveraged by forensic medicine, and now criminology is using ancestry data in interesting ways that may or may not violate people's consent, cross-generationally even. So
another area I've heard about is that I've been told by genealogist friends of mine that the era of anonymous gamete donation is basically gone, because you can give your own sample to Ancestry.com and they will show you a bunch of people in the country who are closely biologically related to you, who are also in their very enormous data set.
Right.
And if you get that information and you Google around a little bit, it's very easy in many cases to find your gamete donor parent.
Right.
And so people who donated thinking that they were donating under a condition of anonymity are discovering that it's not so anymore.
Well, and that's part of the issue, because it's really beyond an individual's control, because you can control whether you choose to or choose not to donate your own blood or have it tested, right? But you can't choose what another relative, and perhaps intergenerationally somebody is going to do, whether that's an aunt or uncle, or whether that's a nephew or niece, or somebody, a cousin across. So, I think going forward, this is really changing the whole landscape in terms of identification and even more broadly, identity. Because what's also just fascinating is the distinction between sort of identities, racial and ethnic identities that we recognize and think about culturally, and then what gets returned to somebody on an ancestry database, which can be wildly different, right? And so from a medical perspective, that becomes really interesting, because sometimes the thing that's medically significant has nothing to do with the cultural affiliation, right? But might not even be known.
Right.
Yeah. So
how have you enjoyed the students this summer?
Oh, well, the students at Yale are always great. I mean, the Summer Institute in particular, because one thing I think that marks this institute is the level of international participation. And that is really refreshing because it brings a whole range of perspectives. And, you know, I learn a lot. I mean, I learn a lot, so I'm doing ethics of information, and then the students are saying to me, well, you know, in Europe we have different data laws. And oh yeah, I've read about that, but here now they have some actual experience with it, or they're learning about it in their law school or, you know, in their medical school. And so you get much more firsthand kind of information coming from those students, and it really adds a lot to the conversation.
Does your teaching in the summer program inform the way you teach when you teach your students at MIT?
It does. I mean, I get some examples sometimes from students at the Yale Institute. I think most importantly, I think I've just begun to understand that there's a framework. You know, there's a bioethics framework that can be applied to lots of issues. So even though in the past I think I've been discussing a lot of the similar topics, I didn't always have that vocabulary or language. Mm-hmm. And I think that's been one really rich thing about this program, not just for me as a seminar leader, but I think also for the students, because they can take that and bring it back to their own interdisciplinary, you know, work. Yeah.
That's great. Well, thank you for teaching 2 courses this summer, which is a lot, right? In 3 weeks. So you were meeting.
I met for very long chunks of time on Monday and Wednesday.
All right.
Is what it was.
All right. There's
yeah.
still a lot to do.
Yeah.
And do you happen to know if any of the students in the poster session are doing stuff that came out of your classes?
It's interesting because I think sometimes it does affect their topics, although because I'm in the second session, they had already selected topics largely, but I see, you know, tinges of my influence.
See some impact.
Yeah. In the
excellent.
So
you're molding those minds.
I'm looking forward to the posters. Yeah.
Good. Well, thanks very much, and thanks for consenting to this interview.
Oh, sure.
And hope we'll see you back next summer teaching more.
Yeah, sounds great. All right,
thanks.
thank you.